Hello, welcome. My name is Dr. Lucille Carriere, and today I'm going to be speaking with you about the emotional journey of atypical Parkinsonian disorders. This will include multiple system atrophy, cortical basal degeneration, and progressive supranuclear palsy. I'll be speaking about these today, kind of in general, from a general perspective of these APDs, as we kind of navigate some of these various aspects. All right. So today, again, what we're going to be talking about is the emotional impact of living with these disorders, common emotional challenges that one may face living with and living alongside as care partners, as well as discussing the importance of emotional support and resources. So it's important for us to start out talking about really what makes these types of disorders really unique. And there's several key features. These are often grouped in with larger movement-based disorders, but these really have pretty kind of unique aspects that are really important for us to appreciate on the emotional journey. Certainly, the extended journey and time it takes to diagnosis can be fraught with considerable frustration, anxiety, worries. We know that the majority of those living with these three different types of disorders can often be misdiagnosed, taking years to get to a diagnosis. We know that the rapid disease progression can also be considerable and impact one's emotional state along the way, particularly for those living with it and as care partners. We know that the absence of curative treatments can also be an aspect that's unique with these disorders. Related limited responsiveness to levodopa, treatment modalities, as well as the management of a wide array of symptoms. Certainly, we recognize the impact of the motor symptoms, but along with these disorders also comes cognitive, neuropsychiatric, emotional changes, as well as autonomic features that really can have a considerable impact on an individual. It's really important for us to understand the context in which we're going to talk about emotional functioning and emotional adjustment. Certainly, each individual's experience within each of these three disorders and even the subtypes of these disorders can be highly individualized. We know that the symptoms can vary from person to person and include, again, a wide array of symptoms that can be affected. These symptoms can occur really at all disease stages, and that progressive nature tends to continue to be really the defining feature, whether they're new symptoms that are continually emerging or we're seeing a worsening of older symptoms. But one can really speak to the negative impact that these symptoms can have on quality of life, and really looking at quality of life as that subjective sense of one's well-being. That is, we're taking into account all aspects of one's well-being, whether that's physical health, emotional, your cognitive, what's going on in your environment, as well as your social health. Certainly, the daily challenges can be immense when living with these disorders. I highlight here just some of the kind of key aspects that living with these different disorders can create in one's kind of physical functioning, how it relates to one's thinking, the practical adjustments that need to be made continually in managing everyday life experiences and activities, the emotional changes, accounting for those losses, the symptoms that are continually emerging, changes in personality, and of course, we have to speak to the relationship changes that are continually occurring. That sense of isolation, the roles that are shifting, and how one is coping alongside their care partner, or if they've got multiple care partners in place. So, again, this just speaks to the accumulation and the burden that these symptoms are having on one's experience in living with these different disorders. When we think about specifically those emotional and the functional impact that these symptoms have, we really start to think about this theme of loss. These losses can be gradual, or in the context of some of these symptoms, can appear quite sudden. And so, again, there's a continual adjustment as it relates to how one thinks about their body, their sense of independence, the threats that are continually occurring, one's sense of self, their roles and responsibilities, right? The changes that are happening as roles are changing within relationships, and thinking about the future. Really, the continual change continues, or really becomes kind of that defining feature of loss. And so when we think about this also from the perspective of the care partner, this is really where we think about the concept of ambiguous loss. And this is a special form of grief, one that is defined by a lack of closure or resolution, in the sense that your loved one is physically present, but psychologically or mentally may not be as present or even absent. And so, again, that lack of closure, you're caring for this individual, but they're psychologically just not as present or as engaged as they used to be. And it can really lead to complications in grief and loss. It's confusing as you're navigating those types of relationship dynamics. It might lead to frustrations, resentment, even senses of isolation. And so it's important to recognize where these symptoms can have such an accumulating effect, not only for the individual living with with this diagnosis, but also their care partners and their support network. So I want to talk a little bit about some of those more specific individual responses along the disease. And I really want to highlight this in thinking about the disease journey. This is a study that was recently published from the perspective of PSP. And I think it highlights really some of these key emotional responses along the disease continuum. That is, it kind of gives us a map to perhaps start to understand some of these experiences. And this included a survey and qualitative interviews with those living with the disease, their care partners. And it was really one of the first to really look at what are some of these emotional responses that are occurring along some of these kind of key points along the disease journey. So in thinking about just getting to that diagnosis, those frustrations, the worries, the uncertainty that's leading up to that. And so we finally reach that specialist, we finally reach that diagnosis that's been rendered. And what were some of those key emotions, themes that were emerging? There's a sense of shock. What does this mean? There may be a sense of relief, even. We finally have an answer. So now that we've labeled it, what are my treatment options? And there becomes then a sense of worry, anxiety. Is this going to help us? Is this going to improve things? And maybe there's elements and flashes of hope. All right, so perhaps now we've got the right rehabilitation therapies in place. Maybe we've got some symptoms that are being managed more effectively, but we start to kind of worry, well, how long might this last? And what are we going to do when new symptoms start emerging? And this is really where, from this study, we saw really the longest amount of time was really spent in navigating and living with this diagnosis. And it was fraught with multiple types of kind of emotional responses, whether it's that sense of depression, a lack of motivation, apathy. Again, continued anxieties and frustrations that we're continually trying to put these practices into place. I'm taking the medications, I'm following my provider's recommendations, and yet I'm still kind of encountering sense of loss and continued decline. There also was an emergence of guilt, particularly from the perspective of the care partner. Am I doing everything? I'm putting all these practices and approaches into place, and yet I'm still seeing decline as it relates to the nature of the disease. And then we enter end of life, and themes that were emerging was perhaps this sense of merciful relief, that the suffering was so great. There was stress and burden as it related to the care partner's experience of this. And so, again, I think it's helpful to kind of map this out to really appreciate these kind of pivots along the disease journey that really helps us to appreciate the different responses, but also gave us a bit of kind of an empirical perspective of what does this look like, right? I'm not alone in this. How are others experiencing this? Also from this study emerged milestones, and that is disease milestones that others were experiencing as it related to, again, that fighting for an answer. You feel like you're continually in this advocacy mode, this kind of sense of loss as it relates to one's identity. Again, with facing continual changes and losses, you no longer feel like yourself. There's this comparison to what you used to be like. The rapid decline, the kind of need to encounter one's mortality as we're looking at, again, these continual changes, threats and losses of independence, more and more support needed by care partners, and the sense that this decline just cannot be reversed. And so again, when we step back, again, I like how this provides just a framework for us to kind of understand where one may be falling at any given time as it relates to these milestones, because these can occur at multiple points. They're not just ones that you experience at the beginning of the disease or at the end. These are kind of continually encountered, right? That sense of no longer feeling like yourself, for example, could be as you're seeking the diagnosis, it's as you're living with it, it's end of life, right? Confronting mortality, certainly we think of it end of life, but could also be experienced early on in the disease. So these are going to trigger just an array of different emotions as these milestones are encountered, but each really deserving of clinical attention such that one does feel that support. Because when we step back and just think broadly about these emotions and the experiences one may be experiencing, we know that these difficult emotions are really a part of the normal aspect of adjustment and acceptance. This is really where we try not to over medicalize or pathologize these times of true suffering. We know that emotions are complex and we want to unpack them in a thoughtful way. They can be influenced by a number of variables, right? Our personalities, how it's important to us, our sense of support really does provide a framework in which we experience and understand our emotions. But we also know that emotions, those at least that can be seen, may be only the tip of the iceberg. I like to often think about emotions and how they run in packs. That is, they cluster together. And so, again, really speaking to that thoughtfulness of unpacking what those emotions are as one is encountering these various different milestones. And again, just that ever present sense of grief and loss that's always seems to be kind of underneath the surface. And this is where we start to think about disease adjustment. Certainly, acceptance, denial are common uh, terms that are used when we think about neurodegenerative diseases, broadly speaking. I kind of like to think more about it from like an adjustment perspective. That is, we know it's ongoing, it's dynamic, it's complex, right? You're encountering new challenges, needing to kind of meet what those challenges are, incorporate it in, but it's changing your beliefs and attitudes. Needs are changing. There's not necessarily like an endpoint of I've achieved adjustment or I've achieved acceptance. It's a continual process. And these perspectives really change over time, how you think about the disease. A lot of that is influenced by how you see yourself, right? Others, your environment. But really the takeaway is that there's no correct way to experience these diseases from an emotional perspective. Each approach has its value, and we need to better understand where one may be coming from when they're really sharing some struggles as it relates of how they're making sense of things, how they're integrating in changes, the fact that now I need to use a cane or a wheelchair, or I'm having to rely on my spouse or partner to help me with transportation. Just a number of different examples where we're trying to make sense of this, and we may need a little bit of time. So when we think about kind of some of the common symptoms that we experience and really that have been researched in the literature from an emotional perspective, this is really where we start to see some similarities as it relates to depression, anxiety, apathy, a loss of goal-driven behavior, as well as changes in irritability and mood. And so I've highlighted here, just broadly speaking, where you see some of these similarities, particularly as it relates to depression, which happens to be really one of the most commonly experienced, emotional or neuropsychiatric symptom that one may kind of encounter along the journey. We know that an overwhelming number of individuals living with these cluster of diagnoses will experience at least one of these. And again, depression really seems to be the one that we see the most frequent. But, when we think about these various different symptoms, what are some of these things that we need to be mindful of, these takeaways? While they're very common, we know that they're very individualized. Some symptoms may have kind of a bit of a fluctuating course, but others may be really more persistent. So it really varies across the individual. And we know that the progression of these emotional symptoms, these neuropsychiatric symptoms, really seems to be independent of the progression we see in other physical symptoms. So this really speaks to the fact that these neuropsychiatric symptoms are part of the disease spectrum. And I really use that as a means of helping families appreciate that we need to understand that, it takes away some of that stigma when we know I'm not coping well with this. We know it's a symptom of the disease and really speaks to the fact that we need to treat it effectively, just as we would be treating some of these other symptoms. We also know that these symptoms can happen early, oftentimes before even the diagnosis is rendered, maybe even before we see some of these motor symptoms. Also, we know that these symptoms can be experienced differently. Care partners in the research have sometimes been, you see discrepancies between care partners and those living with the disease, such that care partners are noticing, say, the apathy, for example, and individuals living with it, not so much. But certainly this is going to contribute to a poorer outcome and quality of life. Unfortunately, these types of symptoms are underreported, which means then they're undertreated. So often what has really been the focus, particularly when we see it in the research, has been the physical symptoms, identification, treatment of those, and really to a lesser extent, these emotional or neuropsychiatric symptoms that certainly warrant treatment. All right, so how do we navigate hope and life when we are confronted and living with these life-limiting diseases? And this is really where I want to present kind of this perspective of hope and how do we cultivate hope. There was an individual, she actually was living with Parkinson's, but she created and coined this term hopamine for those living with dopamine deficiencies. And really what her aim was to kind of create a sense of, appreciation, if you will, for an individual's unique set of desires, experiences, values, and using this sense of dopamine to kind of capture that, such that we approach medicine from a really personalized perspective, that we appreciate that two individuals living with MSA, CBD, PSP, may choose very different paths as it relates to how they manage symptoms and what's the priority. And so it's just kind of a nice reminder that each individual has their own hopes, desires, right, for how they see life and how they're going to navigate these things. And so it's just, again, a good reminder of how we take that hopamine, right, as patients to kind of help really navigate what's to come. And you being in the driver's seat of that is really a critical piece to this. So how do we harness hope as a means of promoting overall health and coping and living with these diseases? This is really where we start to transition from, what's the matter with you? This conversation that may happen with your medical providers, to what matters to you. How do we find meaning and purpose in goals, right? Really meaningful goals, things where we can leverage your abilities, right? Where we focus on what you're able to do, right? So much of these medical visits is what's going wrong, what's not working. And this really allows us to kind of look at it from a different perspective. We also want to really embrace learning more about these diseases. So often in these various different surveys and research on patients living with these diseases and care partners is we hear just a lack of knowledge as to what's to come, what are treatment options. And so it's really kind of leaning into learning more and more about this, but in a way that makes sense for you. Certainly, we wouldn't expect you to download things like an encyclopedia. It really needs to be kind of that right time, right dose. It's also expressing hope through thinking of the future, care planning, right? Being able to express what your wishes are, whether that relates to more formalized approaches like advanced directives, decisions, medical orders. But it also really speaks to who would I want to care for me in the future? How are my care partner and I really going to approach that? What's that going to look like? We also think about how we navigate adaptations and losses. This is really where we start to rely and pull on our rehabilitative therapy experts, whether they're in speech or occupational or physical therapy, really to kind of optimize how I'm going to compensate for some of these losses and abilities that unfortunately I can't necessarily regain, but I can learn ways to navigate around them. Maybe it's using adaptive equipment, making changes in the environment, but we're identifying where we're having trouble. And we're really pulling in these experts to kind of help navigate, right? How do I get to my goal, right? If I want to get back into making model cars, or a stamp collection, for example, but I'm having trouble seeing things or using fine motor, we need to be able to have some tools in place that are going to help us make that a little bit easier. We also look at these lifestyle enhancement strategies, right? We're attending to what our body might need. We're adapting it along the way, right? We're thinking about our emotional and our sleep health, ensuring that those are optimal, right? Again, just listening to kind of where my needs are. So often the list can be so long and seems like it's kind of ever growing. And so in families that I'm working with, it's kind of taking that big picture perspective of what's important today. What is it right now that we can prioritize? List out for me kind of where are your two biggest areas that we're really struggling and where can we kind of align hope? I know we've got a list of 3, 4, 5 different things, but let's focus on these. Let's really kind of uh, provide a bit more focused attention to these areas to help it feel less overwhelming. And of course, we're thinking about what emotional support might really need to be kind of added to the mix. Is this in a more professional sense through counseling? Is it engaging in life review, reminiscence, right? It's really speaking and honoring kind of one's grief. And we also, as we're starting to wrap up, just really thinking about care partners and your role in this. And one thing that is just ever critical is the need for reassessment of what your needs are as it relates to support, but also training needs. This, I think, becomes even more critical given the rapid nature of some of the symptoms and the progression that one experiences. And so, this is really where value can come from emotional support through support groups that CurePSP may be offering, skills programs, right? How is it that I help my loved one with some of these various like transfer tasks or using these adaptive equipment? This is continually again where we see care partners really moving into managing medical and nursing tasks in addition to some of those daily care tasks. And so roles are multifaceted, but they're ever growing. So we may identify needs early on, but we need to continually ensure that we've got support along the way. One thing specifically that we note from care partners with atypical or loved ones with atypical disorders is specifically home safety, right? How do I manage falls, reduce falls? How do we navigate communication challenges? as well as need for on-demand support. I'm really worried. I've seen a rapid progression. You want somebody that you can talk with. So again, this is really where the medical team, the rehabilitative team comes into play, as well as some of the helplines. So the CurePSP helpline may also be a great resource to kind of figure out where those connections could be. And we also need to think about how you navigate really bringing your own support team to the mix, right? This helps to reduce that sense of isolation and impact it can have on your life. Really looking for opportunities for respite and how you get creative with incorporating that in. And finally, really looking at opportunities for meaning and connection. These are going to change over time. Certainly, the negative aspects of caregiving really get and receive most of the attention, but we also know that there's these really beautiful moments and meaning that can be derived from being a care partner. And lastly, I can't speak enough to just the interprofessional care approach to managing these emotional responses along the journey. There's strengths that can come with each of the disciplines that may be part of your team, but it's really about a personalized approach to this. All right, and just wrapping up, emotional adjustment, it's continual, it's unique, but these needs evolve, and we really need to ensure that we've got emotional support resources in place to really help one in that sense of well-being.
All right. Great. Thanks, Lucy. That was fantastic. I hope it's really validating to folks as they feel these complex emotions throughout this process. I think we have time for one great question that we received in the chat, which I will relate to you. Do you have any advice on respecting a loved one's wishes when those wishes conflict with what people might consider best for them? So thinking of someone denying the diagnosis or getting themselves out of bed when they shouldn't be and falling or risk of falling, things like that.
Yeah, that can be really tough, right? As we're trying to really honor wishes and autonomy, right? And one's kind of pursuit of living a meaningful life. But we also recognize there can be safety concerns, right? From a really practical perspective. I think this becomes more and more part of the discussion when there may be cognitive changes or impairment in place. Um, but I think that there's a lot of ways that care partners can approach this in a way that doesn't have them feeling like they're policing things. Because what can happen is it can be antagonistic in the relationship. And one thing we want to ensure that we're striving for is maintaining that connection and that quality within that relationship. So this is really where I would have that care partner really reach out to their team. Talk to the physician, the nurse, the rehabilitative provider, if they do have one, on best strategies to kind of navigate that. It's been individualized, but I think we can get creative.
I like that. I do think we actually have time for one more question,
Sure.
if you're willing. So you talked about hope quite a bit, and I love that. How do you think it can be specifically tied to the concept that there's not currently a cure for these diseases? How have you seen people use hope to kind of combat that fact?
Yeah, I think this is again where we look at the fact and we acknowledge that, right? That there isn't a cure for this. And yet I can still hold space that life can be meaningful in a way that we're attending to those symptoms and areas of struggle that are most bothersome to them. Because even if we don't have a cure to kind of take it all away, there are things in place that we can do now. And I think it's really appreciating that we can do things now, but it requires some back and forth, really, of trying to sometimes identify that. And that can be tricky. Sometimes we may not know, but we need to have that discussion and really appreciate that individual's journey.
Yeah, that sounds like that takes time too. It's not an immediate fix as much as we'd like it to be. Great.
Yeah.
Well, thanks, Lucy, for joining us. It's great to see you. I think we all really appreciate it. And again, if anyone has questions, feel free to reach out to our email and we can get you connected to the right resources. So thanks for joining us.
Thank you.